A very good morning. This is Dr. Mily Mandal, and my topic of presentation today is association of midlife hepatic steatosis with diabetic retinopathy, a cross-sectional study. According to World Health Organization, the disease burden of diabetes is about 422 billion, and there are about 2 million deaths due to diabetes and its complications. Talking about diabetes, it leads to a state of chronic inflammation and increased oxidative stress. A similar kind of disease entity, which is non-alcoholic fatty liver disease, also shows this pathogenesis. The most prevalent age group of diabetes is the middle age group, which ranges from about 45 to 64 years. So what are we trying to assess here? We are trying to assess the association of diabetic retinopathy, which is the most common complication of diabetes, with hepatic steatosis in the middle age population so that early detection can prevent advanced hepatic damage. The aims and objectives. We are trying to measure and compare hepatic steatosis by hepatic steatosis index and liver elastography in type 2 diabetes mellitus patients without retinopathy and T2DM patients with retinopathy. So we'll be assessing and comparing HSI and elastography between the two groups, and also finding the relationship between severity of diabetic retinopathy. So this was an observational cross-sectional study conducted over a period of 1 year with a sample size of 57, where we recruited patients, consecutive patients in the middle age group having diabetes from 5 to 15 years. We went on with ocular examination, lab investigation, and radiological investigation, and data compilation and analysis was done. We followed a strict exclusion criteria. Coming to the ocular examination, it was done and graded by a single clinician. Lab investigation, we performed within 7 days of inclusion of patient in the study. And radiological investigation, we went in with ultrasonography and hepatic elastography. This was also done by a single radiologist who was blinded. So we studied 3 parameters. Number 1, hepatic steatosis index, which is a non-invasive parameter based on ALT-AST ratio and BMI to quantify liver steatosis. Number 2, USG liver. And number 3, shear wave elastography, where we went on with assessing the LSM cutoff values measured in kilopascals and used the METAWAY score. So what is hepatic elastography? Hepatic elastography is a shear wave elastography. It is a radiological method of assessing liver steatosis, and it measures tissue stiffness. Coming to the result, this is a table which is showing the baseline parameters of cases versus controls, where we can see that the age came out to be significant, and later on we went with the linear regression, and the difference persisted even after regression. This is the chart which is showing the hepatic steatosis index with a p-value of 0.012. This is the bar which is showing the hepatic elastography with a p-value of less than 0.001. So what can we conclude from the study? The hepatic steatosis index was significant in the two groups. The severity of diabetic retinopathy in HSI was not significant, but hepatic elastography was significant in both the groups despite a non-significant hepatic ultrasonography. Though the study had a few limitations, being a single-centric study, there was no randomization. It had hospital bias and confounding factors for which we went on with linear regression. We can conclude that our study identified diabetic retinopathy as a risk group for hepatic steatosis in middle age. Though we need to have longitudinal study to know the temporal association, hepatic elastography detected midlife hepatic steatosis, which was not otherwise detected by ultrasonography. Hence, we recommend screening patients of diabetic retinopathy in the middle-aged population for hepatic steatosis so that we can detect it and prevent advanced hepatic damage. With this, I would like to conclude with the thought that an ounce of prevention is worth a pound of cure by Ben Franklin. These are my references. Thank you.